Jessica, what's your
Awesome.
update?
All right. Well, a lot of things going on. So, Lenny, the first thing I would like to address is the whole issue about healthcare access. So, I had the opportunity to participate in the Alliance for Equitable Healthcare Committee meeting. Actually, it was just last night. And then that's where I heard Dr. Morrow give some updates so I can share from him. So some of you may have heard that the health district issued a request for proposal back in December for a consultant to do a comprehensive healthcare assessment for Kitsap County, basically looking at various healthcare access issues, and then also come up with suggestions for how we can address those access issues. Well, that request for proposal closed last month. And actually, I was surprised we got 9 proposals for that request for proposal.
Great.
And some folks from the health district and the public health board reviewed the proposals and selected 2 top candidates, and they'll be interviewed, I believe, by the end of this month. The goal being that, they'll get interviewed, they'll get selected, and then this assessment project will happen this year with the goal of ending by the end of this year. So it's a pretty aggressive timeline. And what Dr. Morrow was talking about last night was, I think they had some really impressive assessments. I think folks from around the area as well. He wasn't able to share who submitted a proposal. And to be fair to Dr. Morrow, we don't typically do that, like share it to the world who receives proposals. But I'm sure there'll definitely be an announcement once a contractor is selected. And I believe he and Mayor Becky Erickson are really involved in that second round, in that round of interviews. So more to come on that, but I'm really excited that there's been progress with that issue. On a side note, it's interesting how many different groups are interested in healthcare access. Just earlier this week, I was contacted by someone with, I think it's called the Kingston Community Advisory Group. It's a group managed by, the county. They are looking at public hospital districts. So Lenny, I gave them your name. I said, oh, well, if you're interested in talking to someone, I recommended the Association for Public Hospital Districts. I recommended you, Lenny. And then I also, let them know about the Alliance for Equitable Healthcare. So you may get a outreach, by someone with that organization. But it's just interesting that so many groups are looking at this issue, and it's my hope that there'll be some coordination, I think, among the groups. But it's pretty exciting, and it's definitely a very important issue where more people should be involved in paying attention. So the health district is, were you going to say something, Lenny?
Well, I was curious, did the Kingston Citizens Advisory Group contact you directly, or did they contact Dr. Morrow?
So they contacted me directly. And the reason why is the person from the committee knows me. She actually used to work with me at the health district. And it was more of a, hey, Jessica, do you know who's, if we wanted to get a speaker on public hospital districts, who should we reach out to? So that's why I mentioned those 3. But it wasn't a formal ask. It was more of a, hey, Jessica, you're for the health district. You might know something. Can you tell me?
Right.
So,
because I do know some of those folks. I can't keep track of who's on the commission and who isn't, but or the group. But I think there are a number of those. I know some of our league members attend the Suquamish one. There's one in Paulsbo too, maybe.
I don't know about Paulsbo.
Silverdale.
Because it's more of a,
county
Kitsap, right? So I know there's one for Kingston, which I know covers, most of North Kitsap. There's a Central Kitsap coordinating committee of some kind. And in South Kitsap, I think it's based in Manchester, I believe. So I think there are advisory groups, in all 3, I guess, quadrants, if you will, not quadrants, but, sectors of the county. And right now,
anyway, that would be really a good outreach, I think, for us to do. So I'll follow up on that. If I don't hear from somebody, I know who to contact there.
Well, Lenny, so the person who reached out to me is Ruth Westergaard. She used to work at the health district, and she was just going to confirm with the rest of the committee that they still want to do this. But it sounds like they, were interested in, I don't know if it was like writing a letter of support or something like that, but I think they wanted to educate themselves first on public hospital districts. So that's where they were looking for, a potential speaker on that. And I did mention, Lenny, that you were part of that statewide, that the state league work group. So some other things going on at the health district. We are updating our strategic plan, and we're going to be inviting, certain community members to give input on that. But it's pretty exciting. I believe this update should be done by the end of spring. But basically, we're looking at our strategic initiatives and if they need to change, if our goals need to change. And I think we're even looking at our mission statement. So, we learned a lot from the pandemic and from issues like equity. So it's pretty exciting. The health district has this internal work group that has employees in it, but then also members of our public health board. And the two members are both non-electeds, actually. Dr. Mike Watson, who's with Virginia Mason, and Dr. Tara Kirk-Sells. So it's pretty exciting. So just know that, and when that is out and about, I'll definitely be able to share that with you all so you can see what that's about.
Can I ask a question about that?
Please.
Would that strategic plan be changed or modified because of the health district's the big survey that's being done by the consultants?
So that's a really good question, Anne. So what I can tell you quote, unofficially is that there is a goal regarding healthcare access. I think what that assessment will inform the activities that are driven by the strategic plan, if that makes sense.
Okay.
There is something currently, and there's discussion in the group about ensuring access to comprehensive and equitable healthcare. But the specific activities are going to come after the initiatives and the goals are set, if that makes sense.
Yeah.
There will be detailed action plans, and that's where I think that will be really informed by that comprehensive assessment.
Yeah,
great. And Kari has joined us, so we're just getting Jessica's quick update. Some of this hopefully sounds familiar. Thank you for joining us.
And Kari can also chip in if I'm completely misspeaking. So just to let Kari, please feel free to correct me too. So that's going on with the strategic plan. Kari's going to talk about our assessment process, so I will skip that part. But I think I've told you all about the Kitsap Health Equity Collaborative. So that is a group that the health district is bringing together. And the idea is that we bring communities that have been impacted by inequitable health outcomes. So, marginalized communities like communities of color, LGBTQ plus communities, communities with disabilities, our veterans communities, bringing members of those communities and service agencies together to identify how we can address systemic inequities together. So it's not just about, okay, we're going to promote healthy eating, active living, which is important, but and when I say systemic issues, like these are like broad ranging, multi-organizational, multi-community issues like poverty, racism, sexism, healthcare access gaps, and things like that. One of the interesting things about bringing this group together, though, is we really have to clarify how we're different from other organizations like Kitsap Strong and all these other equity kind of coalitions. So we are working on clarifying how we're different. But definitely more to come on that. But that group has met at least twice. We now are going to be meeting every other month, and we have representatives from roughly 30 organizations representing various communities. So that's pretty exciting for us. And they're leading what our initiatives are, not the health district identifying what topics to address. And I can send this via email, but our last public health board meeting, that was the first Tuesday of this month, had some really great updates. And I'm not just saying that because I gave an update, but if you want more information about the Equity Collaborative, that's part of it. But if y'all get the chance, there was a really great presentation by my colleague, Erica Juarez, about the child death review process. That we used to have this, and it's been on hiatus for 7 years, roughly. But it's a multi-agency approach to look at child deaths, and not from a place of blaming, but more in terms of, how did the child die in the context of their home? Are there ways that we can prevent deaths like this moving forward? And are there policies, systems, educational changes? And so that group is coming back, and they're going to have their first meeting in March. And this group historically, they've done things like advocate for graduated driver's licenses. They've really advocated for beach safety and things like that. So this is really exciting, and they have representatives from both the tribes, the fire districts, the medical examiner's office, I believe a pediatrician as well. So it's going to be this really interesting multi-discipline group that's going to be meeting quarterly to look at different cases. But this is just really, I think it's exciting because it looks at prevention, but really looking at how things have happened in the county. So there's definitely more to come on that. But if you get the chance, Erica's had a really excellent presentation.
Okay.
And for those of you who may be really interested in communicable disease trends, our communicable disease epidemiologist, Wendy Inoue, did a wonderful presentation, and it was 16 minutes long, and it was just amazing. She talked about how she's just really thoughtful. It looks like a respiratory illness season is kind of getting back to normal, if you will. I mean, COVID kind of turned everything around, and we didn't see influenza for 2 years, very much in Kitsap County. But there's some information there about respiratory illness seasons, and she gave a really great description of what we're looking at as a health district in terms of being able to look in the future and kind of predict, even though things can they always happen the way that we expect. But just look at how we're going to look at COVID and flu moving forward. She also talked about other diseases like Mpox, which is what we're currently calling monkeypox. Monkeypox is much more stigmatizing, I guess way to call the disease. But she gave a quick update on some of the numbers with Mpox. But if y'all are interested in Mpox, there's going to be an update on that at the Public Health Board meeting next month. But Wendy did a wonderful job also talking about tuberculosis. I think a lot of people assume that tuberculosis is more of a disease outside the United States, but it does happen here in the US. And it is very labor intensive to help control, if that makes sense. And often it's a disease associated with people who experience really tough lives, right? Lower income, not able to access resources. So Wendy described how it could take 4 to 12 months to do a case management of one person. And that's, doing directly observed therapy. So watching them do their medications, knowing though that some people are resistant to medications, not just like not wanting to take it, but like physically, the medications don't work as well. So if you get a chance to look at that, she does a really wonderful job looking at that and also looking at TB rates in other places as well. She talked about syphilis and gonorrhea and how those rates, we did see a dip. And Kari can talk about this better than I can. I think it was in 2021, but it is an issue. And it's something that, we as a health district really need to look at in terms of who's actually getting the disease. One of the things that we look at when we look at data is, trends might look better because cases are down, but that could be because people aren't going to the doctor and aren't getting tested. So that's why when we look at data, we have to really be thoughtful about what we're seeing and what is actually telling us. And then she talked about immunization trends, and they're not, there's a lot of work we need to do post-pandemic to get childhood immunizations up. But I was pleasantly surprised. I don't know why I was surprised, but South Kitsap School District, I think they have the highest, and Kari can say this better, but completion rate for childhood immunizations for school. So that was pretty exciting. I typically hear that more for other districts, so that was interesting. So if you get a chance though, if you go on the health district's website, you can watch the whole recording of the Public Health Board meeting, and you can also look at the slides themselves. All the presenters had slides and they're really informative, but that was probably one of our best meetings in a while because it had really great content. And I think it was really applicable to everybody. And one other thing I guess I'll just mention.
What was the date of that?
Yeah, it was. So I'm going to take a look, Anne.
February.
It was the first Tuesday. I'm sorry, my calendar. I need to get up a little. The 7th, I believe, Anne.
Okay, thanks.
Yeah, it was great. And if you need, I can also send you a page where if you just want to watch just those presentations, I'm happy to send you that too.
Yeah, that'd be great.
Yeah, and the last thing is 2 issues that are coming up in the community that my team is really interested in is one is racism experienced by students. Some of you may have seen in the paper that there was a town hall for our Latino and Latinx communities and their families a couple, like 2 weeks ago. And there was a meeting in North Kitsap about their experiences with the schools. This was a follow-up meeting and the first meeting happened, I think, last fall, like November or maybe December. So some of the leaders that have been organizing those meetings have reached out to us with their list of, I'm going to call them demands, and I mean that lovingly. I mean, they had, here's what we want to see, which has been really helpful. Sometimes we get feedback about, why aren't you doing this in this community and that community? But, if we're not part of the community, we might not know what the concerns are. So that's something where I'm going to elevate that. There are concerns and very valid ones about Latino, Latinx youth experiencing racism in schools and not being properly supported. And also families being discriminated against, especially because of their language barriers. We've also been reached out by some other leaders as well about concerns about BIPOC, and when I use BIPOC, Black, Indigenous, people of color, their youth mental health, not just, I mean, there's concerns about suicide, but also concerns just about the struggles that they're experiencing. So we're trying to bring people together to talk about who's doing what, because it's kind of fragmented right now, very well-intentioned groups, but there's the ability for us to come together and potentially apply for grant funding. So that's one of the issues that we're addressing. But yeah, if you all have any questions in general about the health district, please don't hesitate to let me know. And if there's a specific topic you want me to bring information back from, I'm definitely happy to do that. But I've got Kari here. And Kari, did I misspeak on anything about what Wendy said?
I'm not as involved with Wendy anymore. So I was listening to the program myself. That was the first time that I had heard it. But no, I didn't. I don't think there's anything that you had that you said that wasn't correct. I mean, yeah, there's some good things I think that came out of COVID. There's quite a few bad things. And then there's, just over the past couple of years, there's so many things that are emerging and changing. And we're still kind of waiting to see how that's all going to fall out and what that's going to look like.
Why don't we go ahead and get started on your part, Kari, so you can race through the whole assessment thing. Whatever you want to say. And I didn't expect you to have slides, but if you do, I can probably figure out how to make that work if you want to share stuff. So
I did put together just a couple of slides. So I'm going to try to share my screen if I can. But they're really not terribly important. I really appreciate you giving me the opportunity to speak to you just a little bit about what we're doing. Jessica touched on, some of the key things that are coming out, and I'm just going to elaborate on that and go through what we're doing. Okay. Let me see if I can share my screen here.
Yeah, make sure I enabled that. I think I did, but I never know. There we go. Good.
Perfect. Okay. So I'm Kari Hunter. I work for the Assessment and Epidemiology program at KPHD, and we do all of the data. So all of the data dashboards that people have loved and love to hate through COVID. We've been trying to work on those and make those better. And just, I think a real key in coming out of that is that we realized how important some data can be in just reassuring our population, reassuring ourselves, and teaching us what we should be doing and what we shouldn't be doing, and when we're doing things right and when we're not. So we're trying, as we move forward, to use data in ways and share data in ways that are understandable and straightforward and as easy as possible. So I appreciate any of your thoughts as we go forward. If you have any questions, just interrupt me, please. The first slide, I'm not sure exactly how to go to the next slide. There we go. The first slide, I just wanted to highlight too. So all of this work that we are doing, we're in the middle of it, really. We're not near done yet, but all of this work that we're doing is really made immensely better because of the partnerships and everyone who's been working on this. And I'm not sure if you can even see all of those names on this acknowledgements part, but Tony Ives at Kitsap Community Resources has put together a fantastic team, and he and his team have been the ones, I think, who have really been pulling all of our community together to talk about what issues we're having now and what's affecting us now and how we feel about our health and our well-being, what gaps there are in our area and what we can do about it. All of this is Kitsap Community Resources and Kitsap Public Health, and Virginia Mason Franciscan Health has been a little involved with us as well. They've been a great partner as well, and we're hoping they'll partner a whole lot more in the future. And then everyone on this side has contributed in one way or another. It's really been just a tremendous outpouring from different groups in our community. Some of them with one of our groups had more than 30 people there to talk about their issues and their problems and make sure that they were there. So it was really important. So for Kitsap Public Health District specifically, we have, in order for our accreditation and for the foundational public health services that we're supposed to be doing, we're doing a CHA CHIP cycle every 5 years. And the CHA is the community health assessment. That's really what we're in the process of right now in year 4 in 2023, of putting together as much data and information as we can on what is going right in our community and what's going wrong in our community and who is working on it, and trying to pull all of that information together to see where there's gaps and to see where we can start to address it. So that's through our strategic plan, that's through the programs that we finance and support within our health district, that's through our partnerships with our other community partners. Dr. Morrow is really big into, like, if we can just get the data out there, the information out there, we can encourage other people to help us out with that. And one of the things he's going to be doing this year as well, Dr. Morrow is putting out a call for proposals to look even deeper into healthcare access, because we did notice immediately when we started talking to people that healthcare access was the biggest thing that people kept bringing up right at first. If you start to ask about what's affecting you and what's limiting your ability to be healthy in Kitsap, access to healthcare was what came up. And then next year we'll be looking into doing, this is more of the CHIP, the community health improvement process. What can we do about it? So next year we'll really be looking into what can we do about it within KPHD. And in case you're keeping track, this is the next 5 years. So we'd really appreciate people being involved in this process these 2 years, but then it will be 28 and 29. So just for planning ahead, that we'll be doing this again. And hopefully we'll have made some progress at that point. So in preparation for this year, in 2022, Kitsap Community Resources has done 9 community workshops. And I feel like I'm bragging on them. So I talked to Tony yesterday and just made sure that he was okay with me bringing it up. But he is just an incredible force and just so dedicated to our community. I think I've really been impressed with their whole team and just their interest in learning as much as they can. I think he really does want to make a difference and want Kitsap Community Resources to make a difference in our community. All of these community workshops came through his partnerships with the community and just pulling in people that were really interested in just talking about what their issues were. He also put together a community survey that ran June through October, and it had more than 4,500 respondents to it, which was more than Kitsap Community Resources ever had on another survey before. All of his partners, including Kitsap Public Health District, put it out. And we got really good response rates by different areas of the county, including areas that we don't typically get as good response rates from, like Bremerton, like downtown Bremerton. And then ages, really good response rates from across the age groups as well, including our younger members of the community.
Wonderful.
And then lastly, Kitsap Public Health District led, actually Jessica did almost all of our 16 key informant interviews, which is more interviews than we've ever done before as a health district, really asking very specifically, what can the health district do? What can Virginia Mason do? What can KCR do to help our community? And these were interviews with our leaders across health systems, human services, education, business, and then community, faith-based, and nonprofit organizations throughout our community. So really, I think a good variety of people. And I think one of our directors at KPHD is in the process of conducting even more interviews to get more information about what can the public health district do to help as we work on our strategic plan. So there's a lot of information there from leaders in our community. And then my team has been working on pulling together all of that data, but then also pulling together a lot of publicly available data on healthcare access, on births and deaths. And we are trying, as we move out of COVID, we're trying to make this much more publicly available. So it's at our webpage, www.kitsappublichealth.org/data. And what you'll see is similar to this picture below. It's a list of links. And they're not always terribly intuitive, but every one of them should look similar. So it'll compare a list of that data piece, whatever it is. Like the top one there is all ages. So across our kids, all the way up as old as you could get, looking at health insurance rates. What percentage of our population is covered by health insurance? And it'll compare Kitsap to Washington. And you can see how we've been doing over time. And then there, if it's available by the data source, there's some subgroups there, just comparing different groups within our community. As depending on the data source, some have a lot of subgroups and some have none or very few. But as much as we can, comparing, is everyone in our community doing the same as all of us? Is there anyone who is doing better and we can learn from them? Is there anyone who's not doing as well that we could help or work on bringing up to the same level? So we've been pulling all of that together, and that's really our process. I prepared just a little bit about what we've heard so far, and it's not at all comprehensive of everything we've heard, because through all of this process, there's been so much. But I think there's two key things that came out to us right from the start that were really important, and that's healthcare access and then behavioral health needs. And they're so interrelated. I just wanted to highlight both of them. So for healthcare access, immediately from the very first focus group that we went to, and Tony said he was surprised to even hear this, because KCR had pulled people together and they thought they were going to be talking about housing or something much more related to KCR. But from the very first focus group, every single one of our focus groups wanted to talk about healthcare and their ability to find a doctor when they needed a doctor. We brought this information back at KPHD to our health officer, and that's the reason he's really started on this process to hire a group that can come in from the outside and look at our system here and give us kind of an external, non-biased view on, is this just part of the national problem, or do we have more of an issue than other areas in the county, in the state, and in the nation? And what can we do about it? What are other areas across the United States doing that are successful, and how can we do that ourselves? And so there's going to be a lot more information, I think, to come out of this. That whole process is going to run probably through the rest of this year. But so this is just initial, but initially from our conversations with the community, we heard a lot of the same things that were in the news, that have been in the news and have been talked about at the Kitsap Board of Health meetings about issues with our emergency department and our EMS. People were worried about the emergency department and the capacity and whether or not they were going to be able to get in if they were really sick. And they were worried about the lack of urgent cares. If they didn't want to go to the emergency department, there's just not that many urgent cares in our county that you can go to. And a lot of people expressed the thought that they were so scared that they wouldn't consider going to the emergency department in Kitsap, that they would drive out of the county in order to go. So we heard that repeatedly, even from people who didn't really feel like that was financially an option. We also heard that people were afraid that they were going to be discriminated against at St. Michael's Medical Center because of their beliefs or their gender. Some people didn't trust the charity process. They had been through the charity care process with St. Michael's, and they felt that it wasn't always transparent, and they didn't always know, like they had to go to the doctor and get procedures done without knowing whether they were going to be paid for it or not. And then we had KCR conducted two focus groups with people, one with people who speak Spanish only, and one with people who speak Hmong. And in both of those, we heard about issues with interpretation. They had to bring an interpreter with them to the hospital. And that's the only way they were going to be seen. If they tried to go by themselves and rely on the hospital's capability to have an interpreter available, a lot of times they were just turned away and told that they had to reschedule, which means, of course, another, wait to get another appointment. And then, the same things that I just talked about in terms of there are very long wait times for a lot of our primary care visits for a lot of our doctors. We do have a shortage of OBGYN providers, and we have a shortage of providers that take Medicaid. So people were talking about for their children and for themselves, it was hard to find an appointment if you're on Medicaid. And in the data as well, so that was what we had heard from our community members, but in the data as well, you can see the same thing. Even before COVID, there was projected to be physician shortages in the US. The Association of American Medical Colleges in 2019 predicted that the US will have shortfalls in both primary and specialty care in the very near future. And out of all of the states across the United States, a lot of states are having issues, but shortages were definitely expected to be seen in Washington. Nearly all of the counties in Washington are currently designated geographic health professional shortage areas, including Kitsap County, which means that they've determined that based on what we need, we have a shortage of primary, dental, and mental health care providers. And that was before COVID. So now looking really, it's not really post-COVID, but whatever we're at right now, looking into 2020 and 2021, the Office of Financial Management in Washington here estimated the number of physicians, and Kitsap had about 63 primary care physicians for every 100,000 residents. And we compare that to Washington overall, or the average in Washington, 63 for us compared to about 90 per 100,000 in the state of Washington overall. And King County has the predominant of those. They're the one county, I think, that's really got a little higher level for the amount of population that they have. So certainly, our population can go over to King County, or at least some of us can. But really, when you look at that, that's a 30% fewer primary care physicians for a similar number of patients in Kitsap, which I think is really important because the majority of our population, the population that really needs to see primary care on a regular basis in order to stay healthy, is not going to be able to travel to King County. And it's not just physicians. We also have deficits in every other level of care. We have 28% fewer physician assistants. And our accountable community of health, which includes Kitsap, Colum, and Jefferson counties, has the lowest rate of specialists, non-primary care specialists in the entire state. So we know that are just workforce shortages in our area. We also have fewer staffed inpatient hospital beds than most other areas in Washington. We have 1 bed for every 1,000 residents right now. And Washington on average has 1.6, and the United States on average has 2.4. So we have less than half the beds here is the average throughout the United States. And that doesn't take into account the age of the population. We're not that much older than the average age across the United States, but we are a little older than the average age in Washington. And the older our population, the more hospital beds they say we need in order to stay healthy. And then perhaps the biggest need that we saw among providers is in OBGYN and reproductive health care. The data showed that we have about half of the number of OBGYNs compared to the average in Washington. So we have about 8 for every 100,000 residents, where Washington has about 15 for every 100,000 residents. And we know that part of this is because of the reduction in the number of obstetric providers, because of the closure of the Navy hospital. There's other things that are affecting that as well. But me personally, having gone through 2 high-risk pregnancies, to be an hour away drive time from your provider, I can't even imagine how scary that would be. And then we see that with our mothers as well, just in terms of outcomes, because yes, we can go over to King County or Tacoma, Pierce, but what we see in our mothers in terms of actual prenatal care appointments is that only about half of our mothers are getting all of the prenatal care appointments that are recommended when they first go in. So only about half of them are actually receiving all of the prenatal care appointments that are recommended for them. And if you look at our first-time mothers that haven't had a pregnancy before, it's much lower, actually. It's about 1 in 3. So it's about 28% of our mothers, first-time mothers, are receiving all of the prenatal care appointments that are recommended for them. So we know that there's just a real need for healthcare access. And hopefully over the course of this next year, we're going to find out a lot more about some of the solutions that we can work on with that. We also know that it affects behavioral health. And there's a lot of things I could talk with you about behavioral health for the next hour or two. But I just wanted to highlight one thing in terms of behavioral health. And it's true across the United States, and it's true in Kitsap as well. That we're really seeing since COVID a struggle with mental health among our youth. We heard from our community that people were really concerned about their mental health, but then how their mental health affects their children, how the teachers' mental health, all the stress of having to track disease in schools over the past few years is really affecting our teachers, and how that stress in the teachers is affecting our kids' mental health. A lot of people said, and it's so hard, they don't even know what resources are available to them in terms of mental health, and to their kids in terms of mental health. Like, if you haven't had issues before, where do you even start to try to find out whether you should be getting help for your kids or not? When we looked at the data, we had increasing numbers of 8th and 12th grade students that have been reporting depressive feelings. So they ask a question about, have you been so sad or hopeless every day for 2 weeks or more in a row that you stop doing your usual activities anytime in the past year? And so they use that kind of as a proxy for depression. And that has been increasing every year that they've asked it. But in 2021, it was almost half of our graduating seniors said that they had that at some point in the past year. And the number of our graduating seniors in 2021 who said that they had thought about suicide was higher than the state's average. And there was really big differences by subgroup. So the groups that had higher percentages reporting thinking about suicide and depression were our female students, our students that identified as non-binary or questioning, and then students in our lower income areas in Bremerton and Central Kitsap. And so it's kind of a lot of issues, a lot of things going on, I think, that we're going to need that access to behavioral health care as well, and even just to primary care to help get people into the care that they need. And so if you'll give me just another minute or two, I'd like to talk about some of the strengths that we also saw, and things that are already happening and already in place, in addition to this call for proposal to try to come up with some solutions. None of this work is KPHD's, and I don't think we've even influenced a lot of it, but there's so much already going on in our community that's really has the potential to be tremendously helpful in these areas. Peninsula Community Health Services has plans to open a medical respite facility in downtown Bremerton, which would add assistance for our individuals experiencing homelessness and help to alleviate some of the strain on the ED. They also run mobile medical clinics and dental clinics to assist with care, and they're planning on continuing that, I believe, and continuing to do that into 2023 and on. I also just found out about this morning. Jay Hughes from KMHS was talking about they have plans to launch a youth mobile crisis outreach team in March, which will be a peer and a mental health crisis outreach member who will work with families in their homes of youth that are identified as having mental health crises. And they will follow up with them with the goal really to keep the person where they're at, in the situation they're at, and help them work through what's going on. And they will allow follow-up. So it won't be like a one-time visit, one-time intervention, but a follow-up afterwards. And it will go out to where people are at, which would be just amazing. St. Michael's Medical Center has plans to add a 74-bed tower to their Silverdale campus, which would add 74 more hopefully staffed inpatient beds to our hospital. And that's still very much in the planning phases, I believe, but that would really help with our inpatient issues. The family medicine residency program is having great success keeping its residents in the Kitsap area. A lot of the residents that have graduated from that program have stayed in this area, so we hope that will continue. Olympic College is working on expanding the nursing workforce in Kitsap through expanding their class sizes, and that could theoretically fairly quickly help us with some of our nursing shortages. Olympic Community of Health is hosting action collaboratives that focus on addressing health on a regional level. People are talking about it. Commissioner Gelder has been holding community meetings to talk about public hospital districts and how that would benefit or not benefit us. And then even things that came out of COVID, like the expansion of telehealth appointments, that might be a good way, just kind of an innovative thinking outside the box way of really helping to address some of these barriers and alleviate some of that need for maybe able to get a few more appointments in and alleviate some of that need when it's appropriate. So there's a ton more too. I'm just mentioning a few that I've heard about that have been going on recently, but there's just a ton more. So I'm so impressed with, I think already our community, even with just a few little hints of like, hey, this might be a problem, has really come together and started to think about what can we do and try to think outside the box. And I'm hopeful there's a lot more to come on that. And I wanted to really thank too, there's just a ton of people that contributed, like I said at the beginning, that is invaluable in just people being willing to come forward and talk about their experiences and where they're at. And without that information, we just a lot of times don't have any data on what's going on. So I really appreciate it. Yes, I'm sorry. Please, Anne.
Yeah, I have a question can you explain more about what the medical respite would be? Would that be to take the patients out of St. Michael's that are taking up the beds that have been there for so long? Or would what would that be, and how large would it be?
Yeah, it would be. That's really kind of the key, I think, is that we don't have a lot of respite care in our area. And Jessica can maybe talk even more to this because I think she may have heard even more. But yeah, that's the thought, is that if we would have some place where it could be a temporary place for people to go who need somewhere to stay, that's the reason they're not being able to be released from the emergency department. And if PCHS were able to open this up, hopefully that would be kind of just a gateway to coordinating all those services that will help them get back to where they need to be.
And how would those services be paid for?
That's a good question that I don't know the answer to at all. Do you have any further information, Jessica?
Bits and pieces. So, and I know that we had Shannon Turner come talk to us a while ago, and he's with PCHS, and he is going to be managing the project to build this medical respite care. center. So my understanding is that the purpose of this center is to help house individuals who still need some medical attention, but not hospital level attention, and also don't have a place to stay. I think the number of people who are going to be taken care of is limited, and the stay duration is also limited. I don't remember if it was like a month or 2 months. So it's, it's not hospital level care, but it's care that they need, like medication, wound care, something like that. Individuals who don't have a home, and it is limited. I think from what I've heard Shannon talk about, I think they're trying to be really innovative with how they're funding this. I believe they're working with the hospital on funding and other funders as well. And I believe that they are moving forward. I don't remember though when they're breaking ground, and I'm not sure if it's going to be next year. But I can definitely see if Shannon has any other news. But yeah, individuals who
Jessica?
or yeah, and I believe they're discharged from the hospital. Yeah, so sorry, Kari.
I think they have a property in mind that's already built.
Yes, the former Sally's place, I think, in downtown Bremerton. You're absolutely right. Yes.
Yeah, and for those of you who may have missed that, we do have the recording of Shannon Turner's presentation to us. November, does that sound right? Anyway, it was either October or November, and we have that. And I know Jessica needs to leave, but Kari, can you stay on for a few more minutes? Great.
Yeah, definitely.
So anyway, I want to remind at least the league members, and I'll put it again in the notes for this meeting, that particular thing, and Kari, you're welcome to go and listen to that sometime while you're doing something else, because it's pretty long. But he shared kind of the plans, and I think funding is one of the things that always gets interesting. You can get a little extra funding when you're a federally qualified program like they are, because they have access to a few different buckets of money coming in besides the usual, Medicaid, Medicare reimbursement. These are folks who don't have insurance probably, but many of them might be eligible, certainly for at least Medicaid. So anyway, I think they'll be looking at creative funding sources outside and above and beyond what Peninsula Community Health Services usually has access to. But that was a real helpful presentation. It's in the early stages, but I do believe they are hoping to start renovating this spring. I think the target was maybe June, and so they would hopefully have a facility open within a year from sometime this summer, which it takes a long time to renovate. Any construction is always a kind of dicey event in terms of trying to put timelines on it. But once you get a contractor, then you've at least got, things moving forward. And I think that's one of the things that he's working on, is the whole project management. So that's real helpful. I had a couple of questions, but I wanted to see if anybody else had questions for Kari first. Both the good news and the bad news is welcome. It's just good to know what's going on. Does anybody else have any questions for her about the assessment process? My questions relate to, I'm going to go look at all the data. Thank you for that direct link information. I'm also going to, Jessica was talking about several reports, and I'm going to remind her to send us the link that has just the 2 reports in it. The board meetings can get quite lengthy, but they move along pretty well. So I think it's worth listening to the whole recording for the monthly meetings, because some months there's more information than others, I'm sure. But one of my questions was, like I said, I can look at the data, but where are we in terms of what I would call the allied healthcare professionals? And there's a number of people in this group who have healthcare backgrounds, nurses mostly. I'm the wife of a retired neonatologist who ran his practice in Yakima for 30 years with neonatal nurse practitioners who made things work. They were incredibly capable of running an NICU in a hospital that just otherwise these babies would have been sent off to Seattle, and you're talking about people who had no way to get to Seattle to see their children, et cetera. So I'd be really curious to know about where are we in, and this is maybe a nursing question that we will ask later when we have a visit from the Olympic College program, which is trying to expand not just the RN, but the advanced nurse practitioner program. Do we have numbers in the data with that, along with the actual physician providers, or is that something that we should ask to have collected?
It's something we really need to ask to have collected.
Okay.
There's a lot of different types of nurses, and the Office of Financial Management keeps track of our healthcare professions, but the nursing as a kind of umbrella is divided into so many different areas, like you said, into neonatology, into my mother was a cardiac specialist, so it's really divided in emergency departments. In speaking though with Virginia Mason, they are conducting an internal review of their numbers, their hiring practices, and we're hoping that as this proposal that Dr. Morrow moves forward with an external company, that they'll come in and really look at not the nurses that are throughout our county necessarily. There's a lot doing a lot of good work, but really looking at our hospital and our nurses that are there. Because Virginia Mason wants to keep that investigation kind of internal at this point. But it's also the diversity of our nurses. When we were speaking with the community, a lot of people are saying, they go and regardless of the staffing, whoever they're talking to, sometimes they don't know whether they're talking to a nurse or a doctor. Being able to see somebody who they think understands them and listens to them is really, really important. So we were trying to stress to Virginia Mason, if they can look at their entire nursing staff and the diversity of their staff, that would be really important. But unfortunately, I don't have anything very specific.
Yeah. Well, thank you. I think that's the biggest of these sort of broad question areas. I told everybody at the beginning, I'm going to be a community person liaisoning with the league on that stakeholders group that's Commissioner Gelder is put together, and they've given it a new name, and I am grateful for that. It's the Healthcare Continuum Stakeholders Group, and I think it's really important to be looking at that. Public hospital districts are something that I've been part of a league sort of education project working on that, and they're one possible solution for bringing in some extra funding for some of these things that don't translate very well into. And the two nurses left on the call are, I'm sure, very familiar with that wonderful system of coding. We pay fee for service, and some things that we provide don't fit any code. There's no decent reimbursement at either Medicaid or Medicare rates, and many insurance companies don't even cover some of the extra services that don't fit into a code. So I have a real problem with the whole bigger issue of fee for service in this country that I won't get into now. But I'm really glad that this group is going to be looking broadly at the whole continuum of healthcare needs as they wait for the assessment, which I think will be extraordinarily helpful. And in my opinion, some of these allied healthcare professional people, first of all, the training time for them is shorter, and it's, I think, easier to recruit what you would call, I suppose, place-bound people who really want to stay in Kitsap County. They need to go to school here for a variety of reasons, and maybe they want to stay here. So I'm kind of excited that might be something that we really get a good picture of, because right now I have no clue how many people there are, whether or not we could solve some of the gaps in healthcare that way. Certainly sounds good to me. Does anybody else have any questions? If not, I'm going to go ahead and stop the recording.